We go now to the Commission. Fostering good health through EU action to fight vaccine-preventable diseases. It's a pleasure for me to introduce you John Ryan, who is Acting Director of the Commission Health and Consumers Director General since March 2012, and he's also the current head of the unit responsible for health threats, that is the communicable diseases, the health security and bioterrorism within the Commission Department for Public Health and Consumer Protection. I have to remind you that this includes also responsibility for issues such as the surveillance of communicable diseases, strategies for prevention, vaccination, avian pandemic and seasonal flu, preparedness exercise, and so on. And he has previously worked in other European Commission departments dealing with the competition of the internal market and on international trade negotiations. And he's also an official of the Irish Civil Service. Now, I think you are on leave, but it's a great pleasure.
Thank you very much. Thank you very much.
And
it's a pleasure to be here with you. I'm on leave for 30 years, which is a long leave, but it means I can go home if anything ever goes wrong. So, thank you very much. And it's a pleasure to be with you this morning, ladies and gentlemen. And I wanted to outline a little bit the status quo as regards vaccination at European level within the European Union, and then to give some ideas maybe as to how the file or the topic could be taken forward in the coming years. As we just heard, we're moving into a new political framework now. We've had a new European Parliament which has just been elected for 5 years, and the new College of Commissioners has also been elected and has taken its office on the 1st of November. So we're in a period at the moment where new policies are being developed and new approaches being developed. But if I start perhaps by speaking about the status quo, if I can get this thing to move. There we are. So I wanted to emphasize, first of all, that vaccination is essentially a competence of the member states, and under the treaty which establishes the European Union, the Commission supports the member states in maintaining or increasing vaccination coverage against a range of vaccine-preventable diseases. And this cooperation focuses on diseases with elimination or eradication targets. Now, as regards the status quo, we have several legal and financial instruments which I'd like to mention. The first relates to seasonal influenza, and this was a decision of the European Parliament and the Council in 2009 to adopt a recommendation on seasonal influenza vaccination, where the member states were encouraged to adopt and implement national, regional or local action to improve the level of seasonal influenza vaccination. I'll be speaking more in detail about this later on in the programme. It was based on the recommendations adopted by the WHO and focused on particularly persons in the older age group over 65 years of age and persons with chronic medical conditions. The second instrument was adopted by the Council during the Hungarian presidency and relates to childhood immunization. And the Council invited the Member States and the Commission to share experiences and best practices to improve vaccination coverage of children against vaccine-preventable diseases. And it underlined, I think importantly, that Europe has failed to meet the target of elimination of measles and rubella by 2010 because of a lower than required vaccination coverage prevailing at subnational levels. And of course this situation is continuing as we speak. There's also been an interesting report by the Polio Committee of WHO which shows very worrying levels of polio vaccination in some of our member states, which is a concern at the moment. The third legal text which I'd like to draw your attention to was adopted in October last year, and it allows for the adoption of legal instruments on epidemiological surveillance, on monitoring, and on response to serious cross-border threats to health. Now, serious cross-border threats to health are defined as including about 49 communicable diseases. But it also covers threats from chemical or biological or biosecurity threats, but the focus is on communicable diseases. And here we base our surveillance system on case definitions and on a European system for the collection of indicator data through the European Centro for Disease Prevention and Control. This allows the production of regular data on the increase or the decrease in communicable diseases across Europe, including those, of course, which are subject to vaccination as a prevention. And we are launching at the moment a questionnaire to the Member States on their preparedness plans, which also includes aspects relating to vaccination. So we should have the results of that sometime this month. And finally, I'd mentioned the health program, which is our financial instrument, and which provides for funding in the area of public health. And we have several examples of projects which have been funded recently in the area of vaccination, but also the Horizon 2020 research program, which contains a very substantial part relating to research into new vaccines and also social research on, for example, vaccine skepticism. So these are the instruments which we have at the moment. If we look now at the challenges in the field of immunization, from the Commission perspective, we see that there is a lack of a political commitment to immunization as a prevention measure. And we see this through the levels of funding and investment which are made in the Member States in the immunization policies, but also in the lack of commitment by politicians, I would say, to politicians, health ministers, to the issue of vaccination, because very often it carries a certain stigma almost in the public mind. If a minister speaks in favour of vaccination, it also is a certain risk. There's a certain risk attached to it. So secondly, there's the issue of the understanding of the value of immunization among healthcare workers and the general public. And of course, if we're talking about healthcare workers, this raises the issue about medical curricula and continuing medical education, and how immunization can be promoted as a preventative measure as part of educational curricula, not only for medical doctors but also for nurses and midwives in particular, I would say. And we see, of course, the roll-on effects of vaccine hesitancy in the general public. There was a case quoted to me last night of the outbreak of measles in Wales, where the fridges of the GPs in Wales were apparently full of vaccines, but the public was actually refusing to produce their children for vaccination until, of course, the outbreak occurred, at which time everybody started queuing up to get vaccines. So this is one of the issues about vaccine hesitancy among parents, which really is a big issue. And it's underlined by this lack of advocacy among healthcare workers to advocate vaccination. And finally, national immunization programs in the European Union are insufficiently addressing demographic change and demographic aging and the epidemiological shift in the European population. Now, if we look at some elements for the way forward, we have Italian Council conclusions which are due to be adopted on the subject of immunization. They've already been agreed in principle, and they need to be adopted now by the ministers on the 1st of December in the Health Council. And this, from the Commission perspective, is a welcome development in the sense that it brings the issue of vaccination back onto the political agenda. Ministers will have to take a position. these conclusions are adopted unanimously by the Council of Ministers, so therefore every minister has to say yes or no, and has to read the text and has to agree with what's in the text. So from that point of view, it's a good political process. It's also an opportunity for us to bring vaccination back on the agenda and to provide a basis for development of a future EU vaccination policy, because as we've heard, vaccination should be at the centre of our prevention in public health. It's not at the moment, and this would be a very strong signal, I think, to the Member States to work on vaccination in the coming years. And in particular, this focuses on, the conclusions focus on the importance of channeling of funding for research and the monitoring of the impact of the national immunisation programmes. So one of the interesting things about the Italian Council conclusions is the fact that they move away from children's vaccination and they address a whole life, a life course approach to vaccination. Secondly, that they focus on expanding the immunology and vaccinology components of basic and continuing medical education. Thirdly, the issue of exchanging information on national programs is stressed, and looking at cost-effectiveness studies which have been carried out and sharing information, in other words, on the health technology assessment aspects of vaccines. And finally, encouraging research into new vaccines and therapies. Also, the question of how to improve communication with the public and to try and improve the perception of vaccines among the general public and among particular groups in the general public. And providing guidelines on the strengthening of the financial consistency and sustainability of national programs. So in terms of the future EU policy which we're thinking of developing, the Commission is presently working on a policy framework for a strategic and life course approach to immunisation, in line with the strategic objectives and strategies developed in the WHO Vaccine Action Plan 2015-2020 for the European region. This initiative will focus on strengthening political commitment, on increasing the understanding and value of immunisation and services in vaccines, and on integrating immunisation systems into health systems. So it will be very important to embed and to establish solid financial planning and to work on cost effectiveness analysis when we're talking about vaccination with the Member States, and work together with the national immunisation technical advisory groups, the so-called NETAGs, to strengthen efforts for targeted implementation research. For example, looking at vaccine development, on cost effectiveness, on benefits of lifelong approaches to immunisation, on reasons for vaccine hesitancy, and on the effectiveness of communication on this issue. So one of the ideas which we're planning to put into this system is to integrate our work more closely with the work going on at the community level on health technology assessment. It doesn't really make a lot of sense for 28 individual countries to carry out individual assessments of new technologies, including vaccines. It makes a lot of sense if we can put this work together. So this is one of the improvements which we hope to introduce. As regards training of healthcare workers, this is another of the elements which will be covered by the policy in terms of improving the initial and continuing education and training of healthcare workers so that healthcare professionals can advocate immunisation more actively with their patients and deal with the reluctance of the general public in terms of vaccine hesitancy. And we will be proposing targeted e-learning tools as one of the ways of doing this, but also a dialogue with the authorities responsible for medical training in the universities. and also with the national medical associations. In terms of the national vaccination programs, I think it's important to signal that it will be required to strengthen surveillance and monitoring. The idea of a systematic electronic immunization record is one of the improvements that could be made. Coming from a country where there is absolutely no record of immunization, and I personally have absolutely no idea what I was vaccinated against in my childhood, it would be an extremely interesting development to see how the examples of electronic immunization records could be introduced in a more horizontal way across Europe. There would also be development of demonstration projects of good surveillance methods involving GPs and involving those who administer vaccines to children in particular, but also to other age groups. And in this way we hope to improve the funding and the operation and the surveillance of member states' immunization programs. Ladies and gentlemen, the Commission will be looking at this development in the coming months, but first we will be organizing a stakeholder consultation in the spring of 2015, which will specifically be looking to gather ideas from stakeholders, whether it's member states, but also health professionals. And I guess we'll also have a couple of vaccine skeptics who will come along to our meeting. There are some vaccine skeptics who are quite vocal in the European Parliament at the moment, so of course they're welcome to join the meeting, and we'll have to have some sort of a dialogue with them. After which the Commission will put forward a policy paper towards the middle of next year with the intention of getting agreement on a European policy initiative on vaccination as a core part of public health policy for the coming years. Thank you very much, ladies and gentlemen.